Hello, everyone. Welcome to ZamChat podcast. I hope everyone is doing fine. Muli bwanji, mudingai mwane, muli shani. So ZamChat podcast. This is a place where we have meaningful conversations, and today we are joined by Mr. Victor Phiri, who's going to be sharing with us his experience as a chemo patient, and we hope that at the end of this podcast we're able to communicate something meaningful, perhaps to educate somebody, perhaps to teach, or to be able to inform, or basically to be able to encourage somebody out there. So behind the camera, we are joined by Bright Mulenga, who's the technical guy behind the camera. I don't know if Bright, if you want to say hi.
Yeah. Hi.
Okay. So my name is Joe KANEMA, and I'm the podcast junkie. And welcome to ZamChat podcast, Mr. Victor.
Thank you very much, and I'm very delighted to be here.
Thank you very much for welcoming us into this your lovely home.
Thank you.
It's so warm and wonderful and welcoming. We met your brother. So thank you very much for welcoming us here.
Please feel at home.
Thank you. All right, I think we're going to go right into it. Tell me, like, the first time that you were perhaps diagnosed, and then you realized and found out that you had cancer. What was going through your mind in that moment, the time that you received the results of the diagnosis?
Okay. Well. I would pick it from the time when the symptoms actually started manifesting. When the symptoms started manifesting, I had severe lower back pain. I was prone to coughs and flus all the time, and I was taken to the hospital, which was Hilltop. I kept patronizing Hilltop until one time the doctor said, "You've been coming here quite often, and we're not really getting the clear picture of what is happening. So the most important thing is that you should get a proper and clear diagnosis, which is do an MRI or CT scan." So we did a couple of tests. Some of them were electrophoresis test, CT scan, and also MRI. So when we did all those tests and the results came out, I remember vividly. It was in the night. I think that was past 18, 19. I was in bed and with my beautiful fiance seated next to me. Then a doctor came, one of the doctors that I happened to be working with as for now. He came, he looked at the results, and then he said, "You have cancer."
So at this time you were at Hilltop?
At Hilltop. "You have cancer and you need to be moved to Cancer Disease Hospital." Trust me. As a medical student pursuing pharmacy in my final year, I understood what cancer was. But now it was on me. I was devastated and depressed. The reason why I was devastated is because I knew that there was no way out. The only way out was Jesus Christ, no treatment. One. And second thing was, that was my prime time. I was finishing my school, starting up my life. And then I get crippled with a terminal illness. It was really devastating.
So, like previously, before you get the results, where you are told, okay, now you have got cancer, were there any other maybe diagnoses that were done previously? I'm sure, like, you're going through perhaps pain and all that kind of stuff before they're able to find out, like, okay, this is the main thing now.
Okay, what actually happened was like just a few months. I'm a very athletic person. I used to go to the gym. So when I came back from the gym, I remember I was in Chipata. Then I had lower back pain when I got home. The following day, I just started doing self-prescription painkillers. Went to the hospital. The doctors looked at me and they just gave me diclofenac and something to rub on. Later on, when I came to Lusaka, the first diagnosis was lumbalgia, lower back pain. So that came out before the CT scan results came out. So they were just suspecting that it could be it, and they were putting me on a different type of treatment, some antibiotics and some pain relief medication, just to relieve me of the pain. So the myth of a diagnosis was there. Yes.
So at this time, were you already in school at university, or it was before you got into university?
So what actually happened was, I was in school. I was just left with a semester. That was on the 10th of October. My diagnosis was on the 10th of October 2018. Confirmed cancer diseased patient referred to cancer disease hospital.
In that moment, I know you mentioned how you received the news and it was very devastating. Your family, how did they receive that information? Did you tell them there and then, or you
What?
just soaked it in at that moment?
What actually happened was, maybe I should have been the one who was prevented from knowing what was happening. But from the word go, I had a great support system from my family and my relatives. They were always there, and they carried the cross with me. That I can attest to it. And they were very inquisitive, trying to figure out if I was going to come out okay or not. So it was a shock to them, because we don't have any history of cancer in my family or relatives that are quite close to me. So it was a shock, and we were trying to find out how and where. So when you take it back to my relatives, it was bad for them. It was really bad. But one thing I can attest to is that they were constant there with me, and they encouraged me through and through.
Mhm. So now you are at Hilltop Hospital. You find out, you get the results. Uh, what was the name of the cancer that they found you with, in terms of the diagnosis?
Okay, so I remember very well. I had very good doctor, orthopedic doctor, Dr. Choa. Very good man. I think he's at Levy. He came, he looked at the results. He couldn't believe it that I was diagnosed with multiple myeloma. This is a cancer that affects the plasma cell, and it targets the bones, the long bones in your body. So he looked at it and said, "You are young. You can't have such a cancer. This cancer affects people that are above 40 and 50 going up." But it was what it was.
Interesting. So like after Hilltop, you now find out this condition. At what point do you basically like start treatment, or what's really the procedure, like from the moment that they find out that you say, okay, now you have this cancer, to the point that they perhaps put you on treatment? What is the whole process in between to get there?
So what actually happened? Basically, I'll be using my experience.
Mm-hmm.
So what actually happened was, when I was sent to CDH, Cancer Disease Hospital. I think that was the following day. The first thing that I had to start doing was to start doing investigations. They started doing investigations whilst putting me on empirical treatment, because there were a lot of things that were happening in my body. They started doing investigations and further investigations to have a conclusive diagnosis, and also to see to it that I should be in a state that I can be able to receive whatever type of treatment that was going to be given to me. At that point, we didn't know if it was going to be radiation or chemotherapy. So when the time came, Dr. Lishimpi, who is the PS now, he came through and he looked at me and came up with the therapy that I was supposed to be given, which is targeted therapy. So the treatment could not be accessed locally. It was supposed to be bought from India, so which needed a lot of money. I remember that was 2018. It needed about 26,000 to 27,000. That was in 2018.
That's kwacha?
Kwacha.
Dollars?
No kwacha. Fortunate enough, the church came in. I'm still amazed at what the church did. It just took them 3 days to raise the money. So the money was raised and the drugs were bought. But before then, because of the acquisition period to bring into Zambia, all that process, I had to be put on a different regimen. But the most important regimen was the one which was prescribed. And when it later came, that's when they put me on. They continued with it. Yes.
So with you said targeted regimen.
Yes.
Which drugs are involved in there that they use?
So these are the monoclonals, the new molecules.
Oh, the new molecules.
The newer molecules, which have less side effects. They do have the side effects, but they are reduced because they target the cancer cells and allow the normal cells to recuperate, compared to the conventional, or rather the traditional medications that are readily available. Yes.
Which because the new molecules are quite expensive. So the new molecules are now brought into the country for you to start a treatment. How long did the treatment take?
So what actually happened was, according to the protocol and the treatment plan, was for 6 months. That's about 6 cycles. So when the drugs came in, I started. At first, it was very aggressive.
Are they like? Do you take them orally or via injection? Or?
I did both.
Both.
Yeah, they were oral and injectables, which were IVs. The IVs were infused in, and then there were those that I was taking every day, but part of anti-neoplastic agents, which is like people call it chemo, per se. Yeah. So when I started, it was bad. The side effects were very aggressive, but by His grace and His mercy, I saw myself pulling through until that was July 2019. I went into remission. So when July, we did immunofixation and trying to do all the tests, trying to see if all the cancer cells are detectable or they are not. The M band, which is indicative of multiple myeloma, then discovered that it was not indicative. So that showed that I'd gone into remission. So I went into remission for 2 years. I stayed for 2 solid years off medication, and I was fine.
I just want people to understand, like, because sometimes maybe people don't understand what people go through who are on chemotherapy, in terms of the medication that you take, the toll that it has on your body. Could you just take us through, like, the side effects that these medications had on your body, especially the first time that you start taking these medications? What are the prominent, like, side effects?
You see, when you talk about chemotherapy, sometimes I call myself chemo. The reason I do that is because there are certain things that God do to you never understand. Neither can a human being understand. The first regimen I was put on was ABD, which is adriamycin, bleomycin, and dexamethasone. This was a very aggressive regimen. I would vomit and have diarrhea at the same time. Things would happen simultaneously. I would be anorexic. I would fail to eat. I lost a lot of weight, and also my red blood cells I was always anemic. So when it comes to anti-neoplastic agents, chemo, it really takes a toll on you. It really takes a toll. That's just the reality, and that's how honest I can be. It takes a toll on you, but the most important thing is that you need to keep your faith afloat, and away from it, you need to understand that the prerequisite of treatment is nutrition. Yes, you need to be on a proper diet for you to really recuperate, and for the medication also to work very well. You understand the principle of medication with regards to nutrition as well. So when like you asked the question, chemotherapy takes a toll on you. You vomit like I don't know. I remember one time I vomited, like that day I felt like I was going to die because I was vomiting through and through. So it really takes a toll on you.
And I think it also just speaks to maybe even just in the medical field, when it comes to cancer treatment, how it's almost like it's funny, because the medication is supposed to make you better, but then the side effects are just so, prominent and so bad, just as the actual disease they're trying to treat, which is very funny. I think in terms of medicine, there has to be that improvement, especially when it comes to chemo. But I think it also just speaks to how the actual drugs are. Most of them are not that specific, so they're targeting so many cells, and so you find that the side effects are just so prominent. I want to now understand. So you say 2 years you stay, you are fine, you are not on any medication. Um, is there a situation that occurred where the cancer came back?
So yes. So what happened, Mr. Kanema, was 2 years I lived my life. I could go to the gym, do whatever I wanted to do.
No pain in the body.
No penny, no nothing.
No
I was
nothing.
just okay
Mhm.
until I noticed that I couldn't lift weights anymore.
So which year is this now? So
That
from
was
2019,
That was 2022.
2022.
2022. I just noticed that when I go to the gym, I couldn't lift even a load.
Mhm.
I couldn't. I was like, I would have pain, clavicle pain, humerus pain. And I said, okay, this is too much. Talked to the doctor, said, okay, do an x-ray. When I did an x-ray, it showed that the cancer had come back and it had invaded the bones.
Mhm.
Yes. I couldn't, when that message was given to me, trust me, I couldn't believe it. I couldn't believe it, and I couldn't take it that the cancer was back, and it was back full blown.
So this time around, you are receiving this information almost similar to the first time that you received it. How do you take this particular information for the second time? Like, you know that you're fine, you are healed, your body is okay. 2 years down the line, for the second time, they come and tell you that the cancer has come back. How did that take a toll on you in terms of the mentally?
I was pretty much defeated because I kept thinking, I start going back to the same things that I went through with regards to treatment. No, I can't. No, but there was nothing I could do about it. I was depressed again for the second time because I had my life. My life was given back to me, and I felt like somebody was trying to pull it away from me. It was. I remember when the doctor told me. I looked at her and said, "No, it can't be." And she just looked at me that the cancer is back. I said, it can't be. But truly, surely it was back, and very aggressive this time around. Cancer cells, when they come back, when they replicate and proliferate, they come aggressively because at this point now they've brought in other friends. So now the pain was on a different scale, and the treatment regimen required to be different, which I think we paid a blind eye on that one. What I mean we paid a blind eye is when we reverted to treatment, we reverted to the same therapy that I had at first. I did about 6 cycles again, and when we looked at the progression was just low. And when I'm talking about six cycles, that's about 6 months of chemotherapy and the aggression of chemo. Then only you discover that the tumors are not being suppressed. And these are things that people actually go through at Cancer Disease Hospital, and I see that every day. It's not all the time that when you're on chemo, magic will happen. No, sometimes you can be on chemo and then the tumors will keep progressing. So, and that's what actually happened. Yes.
So what causes that, where somebody is on chemo, but then it almost seems like the medication isn't working, and there's no progression, like positive progression towards the treatment? What normally causes that?
Okay, those are things that I've really paid attention as with regard to my work as a clinical ward pharmacist there. One of the things I've seen is that the first thing is misdiagnosis. So the pathology can go wrong. So the pathology can go wrong. If the pathology is going wrong, even the treatment becomes wrong. So if the treatment is wrong, the tumors will keep progressing. There are certain medications that you can give for a certain type of cancer and you expect the patient to respond. That's one. Two, you question the medication that you're giving the patient. Is the medication efficacious or not? All those factors actually get to be put in. These are things that patients experience. Somebody came with tumors that were very small. Within treatment, they escalate. And you start wondering how. So in most cases, for me, I think the pathology is found wanting, because the pathology is the one that tells you what you're supposed to do. So if the pathology is wrong, everything that follows is wrong. And away from that, delay in terms of treatment is also another problem. You find that, yes, this patient has been diagnosed with cancer and is supposed to be put on this medication, and those medications are not readily available. I'll put myself on the chopping board. From the time I was diagnosed until today, my medication is bought from India. I've never accessed my medication from Zambia. So you see the lapsing period. And we're talking about dollars, we're talking about a lot of money that is involved. So it's the same situation with other patients.
I see. So what you're mentioning is that most of the patients that are at CDH, for instance, there's a lapse in the medication because you have to import the medication into Zambia. So between that period, say when you have to import medication, what are the patients taking basically?
It's funny, that's a very good question. But I would want to correct something. CDH strives to do the best that they can to have the medication that would be needed for the patient. But it suffices to say it's inadequate at times. So when you revert to your question, there's nothing. Your treatment plan has been given and you're waiting for your medication. So all you can do, you'll be on pain relief medication just to relieve you of the pain. Remember, cancer is a chronic condition, and the best you can do for a patient is to alleviate pain. That's all. So if the medication that is prescribed is not there, the only thing you can do is just give them painkiller. So you relieve them the pain. But cancer cells never sleep. That's a principle. Cancer cells never sleep. They replicate every second. So by the time you bring your molecules, they might meet resistance.
So I want to understand something. So you being obviously a chemo patient, and also you being a clinical pharmacist who's specifically working in that setup, and you have both experiences, right, as a patient and also as a healthcare provider. What would you say, like in terms of the main causes of cancer, or is it something that is what you call idiosyncrasy, something that just occurs out of nowhere, or do we know exactly what are some of the causes?
Cancers actually emanate from different aspects. No wonder CDH is called cancer diseases, which simply means that different streams. There are those that you can trace. You can trace that this is caused by this organism, cervical cancer, HPV. So that you can tell. But there are certain cancers that you can't tell. Multiple myeloma, you can't tell the causative agent. It's silent. Kaposi sarcoma, you can tell it's coming from the HIV. Non-Hodgkin's lymphoma, HIV. So these have a source. They can tell you, and we can even I can be able to tell you that, okay, if you don't want to get this type of a cancer, you need to prevent yourself from doing A, B, C, D. But those are idiosyncrasy type of cancers, such as the multiple myelomas and the likes. You can't tell where it's going to come from. Some of them is because of history in the family, the breast cancers, they are running in the family. I've seen patients where someone has got breast cancer and the sister also has multiple myeloma, so it's running in the family. But tracing where it's coming from, that's very complex. Maybe the nutrition department can help us, because we're eating a lot of wrong things. So maybe we can attest it to that side. But the certain types of cancer you can't. But those, like the ones we've mentioned with Mr. Bright, those Yeah, those are prominent, and you can tell where it's coming from. And unfortunately, on the map, Zambia is leading in terms of cervical cancer, and the death toll is high. Why? It's because of treatment. When we revert to treatment, the mainstay treatment of cervical cancer is radiation therapy, which we don't have.
So, like a follow-up question to what I asked. Nowadays, the statistics or the stats in terms of cancer diseases seem to be increasing. Could it be that previously we just didn't have the capacity to diagnose such conditions, or truly there has been an increase, maybe due to the environment or food or whatever is happening? Could that be the possibility?
Yeah, you see, these are questions that people ask and tend to discuss. But I think my understanding has been one of the lagging parts that we have in Zambia is diagnosis. We struggle a lot when it comes to diagnosis. With a little preamble experience that I've had, I've seen that diagnosis is a gold standard of treatment. So we might have lost a lot of patients before because we were quite naive. We were naive and we didn't have the little gadgets or devices that we can use to diagnose that we have now. So there's a possibility that cancer has been there for a very long time, but the mere fact that there was no proper diagnosis, due to expertise and also the issue of equipment as well. Yes.
Okay, so now checking back where you were mentioning 2 years, you were okay, and then they now come and then diagnose that the cancer has come back. So this is basically the same cancer that they diagnosed previously, right?
Yes.
So you mentioned that you go on treatment for 6 months.
Yes.
So after 6 months, what happened? Did it how the treatment results? How were the treatment results?
So what actually happened was there were certain symptoms that were prevalent. Like I mentioned, my shoulder. So my shoulder, the clavicle area had excruciating pain, and the humerus bone down here, very bad pain. So when I was on chemo, because I wasn't on radiation, when I was just on chemo was able to manage a certain percentage of the cancer cells, but it could not suffice. So when we re-examined after 6 cycles, we discovered there was very little progression. I remember sitting down with the doctor trying to see what we can do, and the decision was we move to second line treatment. So when we moved to second line treatment and recommendation for further management outside the country, so we moved to second line treatment. I received 2 cycles of second line treatment before I actually left for India.
What is involved in the second line treatment? Which drugs do they
So in first line treatment, in terms of targeted therapy, we had Velcade, which is bortezomib, lenalidomide, and dexamethasone. So second line, it was cafizomab, pomalidomide, and dexamethasone. Yes.
So that's the second line.
It's second line, yes.
So they now put you on the second line.
Yes, sir.
And then after that, there was a suggestion that you go to India
During that
for further
management.
treatment. Or during that treatment.
Yes.
So the second line medication were only available in India.
They were available here. They were actually, they came to Zambia and I started treatment, but the primary focus was me to be sent for further management.
Mm-hmm. Yes. So now, take through your experience in India. When you went to India.
Pharmacist, I can attest to this. I did look forward to going to India for my treatment because I was not getting helped around. The pains were not responsive, even with chemotherapy and your so-called morphine, the drug that you praise the most. I would tell you that cancer pain is, you cannot define it. It's extreme and it's its own. So when you give morphine, there was nothing happening. I remember I would take morphine, I would take Valas, I would take Tramadol. Look at that.
All those combinations.
Yes, I would take tramadol and morphine in the same group. I would combine different medications so that I could get a bit of relief, but it was nothing. So when I went to India, I got to India there. Upon reaching India, I think they gave me a day, and third day they started doing investigations. They did thorough investigations. Every investigation that was supposed to be done was done. And fortunately, the chemo that I was on, which is KPD, was quite responsive. When they went into the plasma cell, they discovered that I'd gone into remission, which simply meant that the cancer cells were undetectable. But the scapula was eaten up by the myeloma cells. So the myeloma cells were feeding on the scapula, and they were radiating pain to the humerus and the clavicle, which simply meant that the chemotherapy was non-responsive. It was not giving any therapeutic effect to it, and the only thing that I needed was radiation. So quickly, they had put me on radiotherapy. I was in pain. I could only sleep one side throughout.
Because of the radiation?
No, because of the pain from the myeloma cells. Mm-hmm. The myeloma cells, I mean the cancer cells. Mm-hmm. Yes. So I would, it was my right shoulder was affected. So I couldn't lean this side. I would only lean this side all the time. I remember I was put on, I think that was 45 gray, 25 fractions, which simply meant that 25 days of radiation. I went through that radiation for, I remember the time I started getting better was on day 22. And I couldn't believe that I had a body free of pain. Because the pain that I had was excruciating and was consistent. And after that, I got better. The doctors decided that I should do both. So what I did was I was getting radiation. Radiation started first. I was put on radiation. Again, they reverted to the treatment that I had in Zambia, which is KPD, carfilzomib, pomalidomide, and dexamethasone. I did 2 cycles of that when I was in India, and the radiation. And after all that, they had to make sure that I'd gone into complete remission before I went into a bone marrow transplant. I know you could be interested in that.
Yeah, so the bone marrow transplant happened in India.
Yes.
Take me through that procedure.
Wow.
Before you get to that, when it comes to radiation, how do they do it? Do they put you in a certain tube or something and then pass radiation through your body, or how is that procedure like? Maybe for people who may not understand.
Okay. Yeah. In simpler terms, radiation. I want to remember my grade 7 very well. I think I did very well here. This is the heat that you get without a medium in between. Mm-hmm. So the same principle is what is applied when you're getting radiation. So like you had explained, they'll put you in, lack of a better term, sort of a casket, something proper. They put you and push you in. When they push you, you'll be receiving, the radiation will be going to the targeted place without you feeling anything. So you're there for 5 minutes receiving radiation, but you don't feel anything. The same way we walk. You walk in the sun. You can feel a little bit of, with the sun we even feel it, but with radiation you don't even feel it. You don't feel anything. But wait later on for the side effects to come. Mm-hmm. Yes. So you don't feel it.
So the side effects of radiation are as similar as the actual medication for chemotherapy?
That's a very good question. Actually, somebody asked me that question yesterday. How do I grade this? You see, when you look at treatment of cancer, each treatment has got its complexity. Mm-hmm. Because radiation can lead to another cancer. Chemotherapy can lead to another cancer.
Wow, I didn't know that.
Oh, the same radiation you're getting, mm-hmm. it can lead to another cancer. Mm-hmm. The same chemotherapy that you're getting can lead to another cancer. Mm-hmm. So what's the catch? Mm-hmm. The catch is it's how fortunate you get to be. Mm-hmm. But in terms of weighing side effects, radiation is way better than chemotherapy in terms of side effect. There are just certain side effects of radiation that you cannot negate. Yes, such as fatigue. That one you can't, because it gets a lot of energy. It sucks energy from you. So when you're on radiation, they make sure, or they ensure that you're on a proper diet. So that because it kills the cells. When the cells are being killed and the energies go low, so you keep eating, and you need to eat very well for the body to recuperate. So during that process, you have serious fatigue. Fatigue is one of the major side effects, and also the site of radiation. If it's on the, like here, the GI side, you have nausea and vomiting. The occipit, or the brain, you have brain issues. So for me, wow, I like to be positive. I've had radiation in a couple of places. I've had radiation to my occipital, kulukobo. A lot of things happen because that's the brain. Yes, I in fact, during that time, I had alopecia. I was losing hair. Hair couldn't grow. I think I remember for a period of about 3 months. So hair could grow somewhere else, and the site of radiation to be blank. So that's one of the major side effects. The site of radiation also will engineer a side effect. Yes.
Interesting. So now you mentioned bone marrow transplant. So which part of the body did they do that bone marrow transplant?
Mr. KANEMA, bone marrow transplant is not something to play with. It's not. Not even a bit. It's an art that is very complicated. So there are two, homologous and autologous. So for me, it was autologous, which means they used my own. So what they actually did was to harvest. They harvest my stem cell. The same way you do with at PEDS, what's that? Kidney dialysis. Yes, they'll make you lie down for a certain period of time to harvest your stem cell. So they harvested my stem cell. After harvesting my stem cell, 24 hours later, they had to kill me.
Okay.
Yes.
They had to kill you.
Yes. So you get a seed, you plant it, and you pray it dies and germinates. And that's what I went through. When you sit down and read on bone marrow transplant, take your time and read. What you read is what the patient will go through. So it's a 50-50 chance. But that's the only treatment for hematological cancers. The treatment for hematological cancers, which multiple myeloma falls into, is bone marrow transplant. The leukemia, the leukemic cells, the lymphomas, all those, you can only deal with them when you do bone marrow transplant, because you are targeting the actual prominent cells which are cancerous. Drugs can only go outside, they cannot penetrate inside. So what you're doing is that you have 95% of the cancer cells inside, and then outside you've got 5%. So your targeted therapy is just outside. So during the time I went into you can actually go into remission, even if they're targeting 5%. You go into remission, but that does not warrant anything of greater benefit.
There's no guarantee.
There is no proper guarantee because
the medication hasn't gone to the actual source.
No. So for you to be guaranteed remission for a longer period of time, you need bone marrow transplant. So when I said they killed, there are certain medications, certain chemotherapy medications that are very aggressive, extremely toxic. So they had put me on they had infused melphalan. Melphalan is a highly toxic drug which kills the bone marrow. So it targets to kill the entire bone marrow, to wipe it out. So they gave me melphalan high dose, and the bone marrow was killed. They expected the bone marrow to regenerate or to build up in 14 days, according to science. So during that period of time, I was in the bone marrow unit, specialized room, where everything is automated. Yes.
So in that unit, you are basically unconscious.
No, I was conscious.
You're conscious.
I was conscious, but with a lot of issues going through. a lot of fevers because the body's ability to fight was unable
Fight
to.
infection.
The white blood cells were depleted completely. So I was put on different antibiotics. So that's most of the times I laugh at drugs because I think I've taken in a lot. Yes, there are very few drugs that I haven't taken in. So during that period of time, I'm given a lot of different medication, and I have fevers. Yes, because the body can't fight, and a lot of things are happening. Every fast replicating cell was shut. The brain.
Even the brain.
Yes, the brain is a fast replicating cell. So it targets everything. So what does that mean? I go into psychosis. What does that mean? I get into delusions, which I went through. So when we look at bone marrow transplant, that's a lot. So I couldn't my hair follicles. Couldn't. I saw my hair falling off. Melphalan is not those are not drugs you play with. Nuclear warfare drugs. Those are the types of drugs, molecules that they use. So they kill the body. So it's a 50-50. It's just God there. Otherwise, you're gone.
So during that period of time, they are growing your stem cells somewhere, while you put you on melphalan, which is stopping the growth of any other cell in the body. But on the other side, they are growing the bone. Is it the bone marrow? They're growing it externally.
So what they do is that's a very good question. What they do is that they harvest. They've harvested my stem cell. So they've harvested my stem cell and they put it somewhere. And then what is remaining in the bone marrow is to be killed. And then that should be brought back. Because when they're bringing that back, that is clean.
It's clean and
Yes.
pure.
And that has to start regenerating. So during that process, you know that the body is devoid of power to fight. So that's in the period for the cells to start growing is 14 days. Yes.
So
The melphalan is just given, it's a one-off dose, which took about, I think, was it 2 hours? I think 2 hours, 30 minutes infusion. And it's done. It goes into the system and it will kill the system. And it does.
there for 14 days.
The melphalan is put inside in to infusion for 2 hours, and it will stay for, I think it stays for 2 or 3 days to kill you. And once you are killed, no. You get the melphalan, and the melphalan is going to be administered for 2 hours, and then after 24 hours, they bring back the stem cells, because your stem cells that were harvested are the ones which are supposed to build. So the ones that were inside your body, they've been killed. So within that space of 24 hours, melphalan is depleting everything with regards to the bone marrow.
Interesting. That's interesting science there. So how do they bring back the stem cells into the body?
An infusion.
So via infusion.
Yes, just as like a BT, bone marrow, blood transfusion, just the same. Yes, it the same way it went out, the same way it's going back inside. So they would come in here, this vein here. Yes.
Interesting. So the treatment is done. The bone marrow transplant is done. The treatment in India is done, and then you come back to Zambia. How has it been since then in terms of has the cancer been treated completely because of the bone marrow transplant that you went through, the radiation and everything? How did all those different types of treatment procedures, did they manage to treat the cancer?
I'll give you the markup. I'll give you the ratios in terms of the cancer cells. So when I was going to India, my ratio was at 44.27 cancer cells in the body. And when I did a bone marrow transplant, I came back to Zambia, after a month, I had to run all the tests to see at what ratio. The ratio had dropped to 1.99. The normal is 1.64. So, which simply showed that bone marrow transplant was a success. So, to to exterminate the remaining cells, cancer cells. They decided to put me on 2 cycles of chemotherapy, the same KPD type of chemotherapy. The radiation which I did in India was conclusive and it was done. So the only thing that I was supposed to continue with is the adjuvant therapy, post transplant, then adjuvant therapy, which is KPD. That's what I'm still going through for 2 months. Then after that, we do the immunofixation test again to compare if I responded to the chemotherapy, and then after that, I should be put on maintenance. Yes, and I'm hoping it goes my way. Yes, I hope I've answered the question.
Yeah, yeah, very clear. And we're also hoping that it goes well as well.
Thank you.
You mentioned, I think one of the things I wanted to touch on in terms of the side effects, to say your eyesight has also been affected because of the side effects of chemotherapy.
Yes.
Mm.
Okay, with my eyesight, it started in 2018. What happened was I've always been myopic in terms of my eyes. So what happened during my treatment, I noticed that I was having a deteriorative sight impairment every day, slightly every day. The way I used to see yesterday and today will be different. I did talk to the doctors. I saw the ophthalmologist, and I remember very well in 2019, on the 26th of December 2019, I had surgery on my on my left eye, which it was indicative that the retina had detached itself. So at Dr. Agao's, they did the retina, trying to put it back. Unfortunately, the procedure wasn't successful. So my left eye is completely blind. It can't even see light. It's very.
So it can't see like completely.
It can't see completely. Once I close my right eye, my left eye can't see. And then my right eye is in the bad state. So when I was in India, they looked, because it was one of the feather management pointers. They should evaluate my eyes as well. They looked at them, they said there was nothing they could do. There was nothing they could do. They just gave me hope that the right eye will never close, and I'm hoping for that. But even driving, I can't really drive. So those are the toxicities that come with treatment of cancer. Yes, sir.
Having gone through, sir, all this, life-changing circumstance in your life, all these different treatment, regimen, treatment procedures, and everything. What has kept you going? What has kept you going through this whole process?
Mr. KANEMA, I can never budge on my faith. I can never budge on my faith because I get emotional at times. Me going is my faith in God. I've seen God work in my life many times, and even during bone marrow transplant, I gave up. I asked him to allow me to rest, but he couldn't, and that's the reason why in whatever I do, I'm quite aggressive. I'm aggressive because it's not by might, by strength, but because of him that I'm still in existence, and I hope to be a beacon of hope to especially the people that are fighting cancer. And I'm so passionate about cancer and treatment and the area of education with regards to chemotherapy. And I strongly believe it's for a purpose. God has made me to be strong, to walk in the wars that almost took me every day. But what has kept me going is the support that I get from the profession, the umbrella of pharmacy. I get a lot of support from people and my family, church people, colleagues, and everyone. I'm the most privileged person because I have a very strong support system. Yes, in my faith as well in God, because I've seen God at work.
As we try to wrap up, obviously this episode, I think I did mention in the beginning that I think we'd also, because of this episode, try to bring in an aspect where we can try to educate or inform people out there regarding chemotherapy or regarding cancer. And I know that is one of the things that you are so passionate about, that you want to teach or maybe educate or maybe spread, something of positive to other people out there, perhaps that may be going through similar situation, or relatives that have somebody that is going through a similar situation. What would you say to such people?
A lot of people look at cancer as a death trap. Yeah, but the most important thing that I would say is that it's more of the brain rather than what people say. So you need to be in a right frame of mind as a patient. And the second thing is the unsung heroes, the people that are around you, the people that give you the support that you need. Like I earlier alluded to, going for specialized treatment is not easy. I always look back. I give thanks to CDH for trying to expedite, and also Pharmaceutical Society of Zambia as the umbrella of pharmacy, and the ministry at large to push for me to go for specialized treatment, because if I didn't go for that treatment, I don't think I would have been here. So the encouragement to the people out there is you need to eat right. You need to eat right, and you need to follow the treatment plan to the latter, and also to we need as much as we need support, a lot of it. We go through a lot as cancer patients. It's a toll on us. We might be strong people looking at us as strong people, but it weighs you down a lot. And we are always grateful for the support, and with encouragement, stay focused and follow through the labs, everything. Follow through, understand your condition to the latter, because you are the driver and you are seated on the driver's seat. So you have to make sure that you ensure that you do the best that you can do for yourself. So take care of yourself. If your body's ability to fight infection is low, ensure that you take extra care. The rules of COVID, follow them very well, mask up all the time, so that you prevent yourself from getting any opportunistic infections. Remember, I've seen patients actually die because of opportunistic infections. So sometimes it's not the actual cancer that can take you. It could be just an infection. Even a flu can take you. So all those things, the most important thing is to pay attention to the guidelines with regards to treatment.
Are there any people out there that discriminate people with cancer? Have you faced such? Have you faced any if discrimination?
For me, my last experience for the last 5 years, I've never been discriminated. I've just had people getting petrified when they find out that you've got cancer. Yes. A lot of people, when I tell them that I've got cancer, I'm fighting cancer, I'm on treatment, they get shocked. But I've never at any point been discriminated. Yes. I'm embraced and I'm supported. So when it comes to, it's just, it's one condition one would never at any point want to side with because of its aggressiveness. Yes. Yes, but in terms of victimization and what, no, there's not. I haven't experienced any of that. Yes, sir.
As we close, um, is there anything that you feel like we've left out that we could have touched maybe as we were having this conversation, or anything that you'd like to say before we wrap up?
The only thing I would say is that I'm so humbled to have you in my house and to be joined on this podcast. And this is very good. And I think it's sending the message to the people out there. And that is, it's an encouragement to me as well. So I'm greatly humbled to have been invited to be on this podcast. Yes, sir.
Thank you very much, sir, Mr. Victor, for this opportunity to chat with you about this. And I hope that we will manage to be able to communicate a certain message out there. I think that is always the goal and the purpose for this podcast, to be able to have meaningful conversations. So thank you very much. Until next time, bye.
Thank you. I thought I was strong. I still get emotional. I thought I was strong. I still get emotional.
Oh, brother, it's okay.